Here's a running analysis video I took at the clinic recently. It's a very good example of the role of analysing running technique in injury rehab. Some background on this runner. He is 28 years old. He had a gradual onset of pain over the outside of the right hip. He had been gradually increasing his mileage up to 50 miles per week and running 5 to 6 sessions per week. He was aiming for his first marathon later this year. So his pain began 5 months ago. He had an MRI which showed a partial tear to the gluteus medius tendon, which is a tendon that runs down the outside of the hip. Since then, he has rested, performed strength and mobility exercises prescribed by his strength coach, and had injection therapy. On return to running 3 months later, it became painful within a few days, leaving him back to square one. And at this point, he contacted me. Prior to the running analysis, a thorough history and physical examination with movement screen were undertaken to give me a good idea of how he moved prior to seeing him run. From the history, this guy had an ACL repair, so he tore his cruciate and he had it repaired 6 years ago and on the affected side. So just looking here at the video, look at the left leg first. Okay, so really our center of gravity is pretty much there in the center, and then when the foot hits the ground, just about here, you can see that's pretty straight down underneath the hip. Okay, this is the ideal position. However, once we come over to the left side, we can see when that foot hits the ground, that's very narrow. Okay, and we'd call this a crossover gait. So quite narrow in comparison to the left. So again, the left foot hits the ground, perfect position, right comes right across. Okay, in this position, when the leg comes across the midline or towards the midline, this is going to put increased tension along the glute tendon. Because as we can see, just when the foot hits the ground, it's nice and level to the hips there. When the foot comes underneath the body, exactly there. Okay, we can see that left hip drops down. And this puts the increased tension along the glute tendon. Now you can rest, you can have injection, you can do all your strength work, which can help, but if he doesn't alter that right foot where it lands, if we can get that right foot just a couple of inches further out, this will really help to decrease that drop of the left hip when the foot comes through. And this is the importance of the running analysis. You cannot see this if you don't get someone running. So at the moment, this guy is running. He is doing a progressive load with his running, which I've designed for him over the next 4 weeks, and then at that point I will reassess him again. He's also continuing with his mobility and strengthening work, as it's very important, but we're keeping a close eye on the volume of running he does, and also then really trying to improve the width of the step on the right side. And I'd be hopeful for him that he'll have a successful outcome and complete his first marathon at some stage. So I hope you can see that as clearly as I can, and it's a bit more info for you with regards to how running analysis works here at the clinic.